Good morning, myself Gopika. Today we will be discussing about the sustained release drug delivery system. So the major contents include introduction, sustained release drug delivery system. What are the key features of sustained release drug delivery system? What are its advantages, disadvantages? What are some major differences between the controlled, sustained, and targeted drug delivery system? What are the factors affecting designing and delivery of sustained release formulation? And finally, the mechanism involved in sustained release formulations. So moving on to the introduction, sustained release formulations are designed to prolong the drug release, which cannot be achieved by a conventional dosage form. So as we already know, the conventional drug release system is needed the repeated dosing of a drug, which is needed to maintain the drug concentration in the body, and which decrease the patient compliance, and also it may increase the toxicity of drugs. So the problem is minimized through the formulation of a sustained release formulation, which initially releases a small amount of drug from the dosage form, and this reduces in the dosing frequency and helps in improving the patient compliance. So, what is a sustained drug delivery system? As we already know, this enables the drug delivery at a prolonged rate, ensuring that its release over an extended period. So, the prolonged release formulation gradually releases the active ingredient, allowing the drug to remain effective for a longer duration. And also, the system extends the drug's availability in the body over a prolonged period, reducing the need for frequent dosing. However, the prolonged release system that only extend the therapeutic blood or tissue levels without precise control over the release rate and duration, which are not classified as controlled release system. That is, as we already know, controlled release formulations can provide the drug for a longer duration, but in a predetermined rate, which is not possible in a prolonged release system where the drug action can only be prolonged for a longer duration, but can be controlled in a predetermined rate. So, unlike the rate controlling drug delivery system, which allows the precise in vivo regulation based on simple in vitro test, prolonged release system primarily focus only on extending the drug delivery. So, sustained release strategies are particularly beneficial for those drugs that are metabolized and eliminated from the body soon after the administration. By modulating the drug release rate, this system can help in maintaining a stable drug concentration in the bloodstream or even in the target tissue, ensuring the consistent therapeutic effect. So, this approach is especially useful in treatments such as cancer therapy, where maintaining the drug levels within the therapeutic window is crucial, and the drug has to be remained in the tissues or the bloodstream for a longer duration for effective treatment. So the sustained release formulation can provide an initial dose required for an immediate therapeutic effect, followed by a controlled release that sustains the drug action over an extended period, typically for about 8 to 12 hours. So the primary objective of sustained release drug delivery is to maintain the drug levels within the therapeutic range over a longer duration to immediate release formulations. This minimizes the dosing frequency and improving the patient compliance and thereby improving the efficacy of treatment. So, what are the key features of sustained release drug delivery system? It maintains a consistent therapeutic drug level in the bloodstream, and also it helps in releasing the drug for a prolonged duration, extend the drug's duration of action, and also it reduces the risk of side effects and thereby improving the patient complaints. So compared to the immediate release formulation, sustained release systems release the drug more slowly. However, the release rate may not be always remain constant throughout the dosing period. So a common example include oral tablets, capsule, which gradually dissolve in the GI tract. And once the drug dissolves in the body fluids, it can be transported efficiently to the target receptors. So next we'll be discussing about the major advantages of sustained release formulation, where it can reduce the dosing frequency, reduces the GI side effects, better patient compliance and acceptance can be achieved, and also only a less fluctuation as the plasma concentration level are usually seen, and also it can provide more uniform drug effect, improved safety efficacy ratio, and also improvement in the deficiency in treatment, reduction in total drug usage when compared to the conventional dosage form, and also it can help in reducing the drugs of toxicity and stabilization of medical condition for which the drug may be provided, and also reduction in drug accumulation with chronic therapy and economic to the healthcare providers. And also the disadvantages includes the dose trimming and reduced potential for accurate dose adjustments is not possible. And also the stability problems are there and need for an additional patient education regarding the drug intake and all. And the physician has less flexibility in adjusting the dosage regimen as it is flexed by the dosage form design formulator, and also cost is more than the conventional dosage form as it has more improved uh, dosage form. And also it increases the potential for first pass metabolism because it stays for a longer period in the GI tract, and also it is possible to reduction in the systemic bioavailability, and also poor in vitro environment correlations are seen. And next, we will be discussing about the major differences between controlled release, sustained release, and targeted drug delivery system. So basically, what is a controlled release? It helps in delivering the drug at a predetermined rate for a longer period of time and a specific period of time, ensuring the consistent and predictable release of the profile of a drug. And also the sustained release formulation, a portion is released immediately in order to achieve the therapeutic response, and then the remaining drug is released slowly, thereby achieving a prolonged duration of time and therapeutic effect, which is not maintained constant. And when it comes to the targeted delivery system, the selective and effective localization of pharmacologically active moiety at pre-identified target in therapeutic concentration while restricting its access to non-targets and cellular linings, etc. Thus, it helps in minimizing the toxic effect and improving the therapeutic effect. So, what are the advantages, objectives of controlled release? It precisely control the rate and sometimes location of the drug release. And when it comes to sustained release, prolonged drug action is possible and it helps in reducing the dosing frequency. And when it comes to the targeted drug delivery system, delivering drugs specifically onto the site of action. And about the dosage form, contributes a dosage form that maintain constant drug level in the blood or tissue, and sustained release contributes dosage forms that provides medication over an extended period of time, and the targeted delivery system contributes dosage form that provides medicament selectively to the target site. And also the release control, tight control over the release and release rate and pattern is seen in controlled release. And when it comes to the sustained release, gradual release over an extended period is possible, and in targeted the delivery system, site specific release in a controlled manner is possible. And when it comes to the kinetics of drug release, controlled release release the drug in a zero order pattern. Sustained release do not maintain a zero order kinetics, and the targeted delivery system may follow any order of kinetics. It may only mainly focus on the site targeting. And when it comes to the targeting of the drug to a specific site, controlled release may contain mechanisms to promote the localization of the drug at the site action. Sustained release doesn't contain any mechanism to provide or promote the localization of drug to a particular active site. And the targeted drug delivery system always targets a specific tissue or cells. So, what are the factors affecting the designing and delivery of a sustained release formulation? So, it can be broadly classified into three: physicochemical properties of the drug, polymer type and concentration, and the biological factors. So, the first one we will be discussing about the physicochemical properties of the drug. The first one is the solubility. So, for effective absorption, the drugs must dissolve in an aqueous medium. Poor aqueous solubility leads to low availability, as the drug may not dissolve fully within the limited gastrointestinal transit time. So, some drugs like tetracycline, which dissolve better in the stomach, but its absorption primarily takes place in the intestine, creating the formulation challenges. So, this solubility issue makes certain drugs unsuitable for sustained release systems unless modifications such as encapsulation with acids or bases improve the solubility. So the choices of sustained release mechanism depends upon the solubility of the drug. Poorly soluble drugs are not ideal for the diffusional system due to their low concentration in the solution, and that can be incorporated into the metric system. So drugs with slow dissolution rates may support controlled release, but it still have limited bioavailability. So next is the partition coefficient and molecular size. So the partition coefficient and molecular size is significantly impact the permeation of the drug through the biological membrane and to the rate controlling membrane. So drugs must cross the multiple barriers after administration to reach their target site. So the partition coefficients with high partition coefficients such as high oil solubility allow the easy membrane penetration but may trap the drugs in lipophilic environments, while low partition coefficient, that is the high water solubility drugs, hinder the membrane crossing. An optimal balance ensures the maximum flux in tissues like the GI tract, skin, and eye barriers. So diffusivity depends upon the molecular size. Larger molecule diffuse more slowly, as you can easily understand. And for drugs with molecular weights between 150 to 400 Dalton, a typical diffusivity in flexible polymers is 10 raised to minus 8 centimeter square per second. So the drug stability is also crucial in designing the sustained or controlled release systems. The drugs in the stomach can be formulated in a slowly soluble form or with a delayed release for small intestine absorption. However, this approach is unsuitable for drugs that degrade in the small intestine and undergo extensive gut wall metabolism as it reduces bioavailability. For drugs unstable in the small intestine, alternative routes of administration may be necessary. That is, in some cases, metabolizing enzyme at the administration site or along the absorption pathway can be leveraged for the controlled drug delivery. So protein binding is the next factor. The protein binding affect the drug duration and action as bound drugs act as a depot, enabling the prolonged release. Plasma proteins are recirculated rather than eliminated, which helps in maintaining the drug levels over time, especially for highly protein bound drugs. Drug protein interaction also occur in the GI tract. Quaternary ammonium compounds bind to the mucin, which can either enhance the absorption by acting as a depot or reduce free drug availability if degradation or washing occurs. The interaction between the drug vehicles and the mucin layer significantly influences the drug absorption and the duration of action. So next we'll be discussing about the polymer type and concentration, which is also a major factor which affect the designing of a sustained release formulation. So polymers play a key role in controlling drug delivery by regulating the release of therapeutic agents. The type and concentration of polymers influence the drug release behavior. So there are different types of polymers which affects this. So hydrophilic polymers like HPMC carbomers which swell in water forming a gel barrier, and also hydrophobic polymers such as ethyl cellulose polyvinyl retard the drip diffusion, and also the biodegradable polymers like PLGA enables the controlled release through degradation. Then next we'll be discussing about the biological factors which include the absorption. The rate limiting step in the drug delivery is a sustained release formulation. Majorly is depending upon the release from the dosage form rather than the absorption. So rapid drug absorption is related to any release is expected. So, but this won't happen in all cases. The drugs with narrow absorption window are challenging to formulate as a sustained release drug delivery system. Next is the distribution. An important aspect of distribution is the binding of drugs to the proteins in the blood and tissues. As you all know, the bound protein of the drug itself acts as a depot, as these drugs can be converted as inactive and unable to cross the membrane as it is protein bound. And also, so at high protein binding, drugs shows a prolonged action. The design of sustained release formulation are mainly based on the drug disposition. So the pharmacokinetic parameters and apparent volume of distribution should be also considered while formulating a sustained release formulation. The next is the metabolism. Metabolism of a drug will be reflected in the elimination of a drug. It is possible to incorporate the pharmacokinetic parameters into the designing of a sustained release formulation, provided that the rate and extent of the metabolism are predictable. Complex metabolic patterns make the designs more complex. So, two areas that significantly limit the sustained release product is another drug which induce or inhibit the enzyme synthesis, difficulty in maintaining the uniform blood levels of the drug. So they are poor candidate for sustained drug delivery. Drug which also undergo first pass effect, fraction of drug doses dose dependent, which result in significantly bioavailability reduction. And also, if the drug is released slowly over a period of time, it is difficult to prepare a sustained release formulation. So the next one is the duration of action. Drugs with short half-life require frequent dosing in order to minimize the fluctuations in the blood vessels. So sustained or controlled release formulation are desirable for such drugs. So the drugs with a short half-life, the release of will be quite large. This will lead to a large dose. So the size of dosage may be exceeded. So the next is the side effects. The incidence of side effect is a function of plasma drug concentration. So the side effects can be controlled by controlling the drug concentration in the plasma at a given time. This can be achieved by controlled or sustained release formulations. The patients screened to tolerate the daily dose of drug, sustained release formulation lower the incidence of GA side effects. Next is the margin of safety. In designing a controlled or sustained release system for the drug with narrow therapeutic index, it is imperative that the drug is within the therapeutically safe margin. So, however, the precise release patterns itself cannot ensure the achievement of a safe plasma concentration of the drug. So next is the role of disease state. Sometimes the disease state may act as a criteria for designing the sustained release system. Example, sustained release formulation of aspirin in rheumatoid arthritis maintain the therapeutic concentration throughout the night, which may be helpful in alleviating the morning stiffness. Next is the role of circadian rhythm, which is also a very important factor of designing a sustained release formulation. Several biological processes and disease state may be influenced by the circadian rhythm. Example, the asthma attack mostly occurs before the bedtime. The designing of sustained release drug delivery system should consider the circadian rhythm to maintain the drug release at the desired duration. Next is the major mechanism involved in the sustained release formulation. First one is the diffusion control system. The diffusion occurs at a region of higher concentration to a region of lower concentration, and it is the major process of absorption. So the flex is given by the fixed law, which is J equal to minus T into dC by dx, where D is the diffusion coefficient and the dC by dx is the change in concentration with respect to dx. And the two methods involved are reservoir system, which is also called as a laminated metric device. It contains a hollow system containing inner core surrounded by water-soluble membrane, where the inner core contains the drug and the polymeric coating can be applied by either encapsulation or microencapsulation or coating. The drug will partition into membrane and then extend into the surrounding fluid through diffusion. And the common polymers used is HPC and also ethyl cellulose. And next is the metric system. The rigid matrix materials used are polymers like polyvinyl uh, polymer and fatty acids, etc. Swellable matrix diffusion, also called as glassy hydrogels, are also used for sustained release of highly water-soluble drugs. Hydrophilic gums such as Gorgum, Tragacanth are used. Semi-synthetic polymers such as HPMC and CMC are also utilized for this metric system. And next is the dissolution control system, where the rate is determined step is the dissolution of the drug from the solid or the drug reservoir. The micro reservoir dissolution control system is the subcategory where an approach to activate constant drug release is used, contain numeric microscopic spheres in which drug is present, and the drug first undergo dissolution, then partitioning, and then the diffusion through the polymeric membrane. Next is the hybrid drug delivery system, where the combination of both permeation control and metric diffusion control drug delivery systems are utilized. It is a hybrid of the both combination, and also the example include chondrin releasing and a scopolamine releasing transdermal therapeutic system. And next is the osmotic pressure control system. The drug combined within an osmotically active salt like NaCl, that is sodium called chloride, contain a semi-permeable membrane usually made up of cellulose acetate. Example, glucotrol XL and procardia XL, etc. This is more suitable for hydrophilic drugs, and this osmotic agents absorb water and create an osmotic pressure, which then lead to the release of drug into the bloodstream or the body fluid. And next, we are moving on to the conclusion, where we already discussed the sustained release formulation and designed to prolong and extend the release of the drug in the body. The same concept is used in the controlled release, but it is more predictable. So there are several differences between the sustained control and targeted delivery system. There are various factors which affect the design and delivery of sustained release formulation, which we have to take in account before formulating a sustained release formulation. This include the drug-related polymer and other biological factors and physicochemical factors. The drug release occurred through several mechanisms such as diffusion control, dissolution control, hybrid, and also osmotically activated drug delivery system. In conclusion, the sustained release drug delivery system is a modern advancement to the drug delivery system. And these are all the references used. And thank you.